and welcome. You're watching FYI. I'm Rishika Barwa. In today's edition, we talk about how COVID is spreading. This is something that's intrigued all of us. COVID-19 is airborne. This is something that we already know. The Lancet, in fact, in April confirmed that COVID-19 is predominantly airborne, which means that it spreads more through the air than it does through surfaces. Now, what we're learning is that even the 6 feet distance or the 2 gaj ki duri is not enough. Remember, this is what's been ingrained in us as Indians to believe that 6 feet of distance is safe. But the Center for Disease Control and Prevention, the CDC in the United States, has warned that the airborne virus can be transmitted even if the infectious source is further than 6 feet away in certain conditions, largely indoors. The new guidelines say that the transmission is possible if an infectious person exhaling the virus indoors for an extended period of time, more than 15 minutes, is even more than 6 feet away from you. And in some cases, infection is also possible. It can be passed on to a person even if they pass through that space after an infected person is left. What do I mean? If an infected person is sitting, exhaling in a room for 15 minutes, once the infected person has left the room, if you enter the room soon after, you could potentially be infected because the aerosols will remain suspended in the air. The CDC says the aerosols could remain suspended in the air from 15 minutes to up to a couple of hours. So that's what we look to understand on FYI today. How can we better protect ourselves given the fact that COVID is in the air? What are the do's and don'ts? What are the do's and don'ts indoors and what are the do's and don'ts outdoors? We have with us on the show today a panel of experts who will help us understand this phenomena and tell us what we need to know. Dr. Chandrakant Lahiriya, epidemiologist and public health specialist, is joining us. Dr. Ambrish Mittal, chairman endocrinology and diabetes from the Max Healthcare. He's been tweeting clarifications on COVID being airborne and everything we need to know. We also have Dr. Vishal Rao, member of the COVID task force in Karnataka. Thank you all very much for sparing your time and being with us on NDTV. I want to begin by asking you, Dr. Chandrakant Lahiriya, how are you looking at these new CDC guidelines? What do we need to know?
Thanks, Rishika. So we know one thing for sure, that now the virus can spread beyond droplets. And before we go into the details, let's understand what is the difference in droplets and what is being talked about airborne. We know the particles, the exhaled particles from individual which are in the size of more than 500 micron or 5 microns can be transmitted or transferred to a surface, and then they will quickly fall on the ground through the gravity. So they are unlikely to affect unless an individual comes into contact with another person. However, if the particles are less than 5 microns, in some cases 1 micron, they can stay in the air either for some time or in an aerosolized form. And what does that mean? That the particles need not to be inhaled or deposited on any surface like a nose or any mucosal surface, but particle can stay there. And if a person who has exhaled those particles leave that space and then somebody comes into that area, that can also be transmitted and person can get infected. But there are other situations quickly coming to that we know that droplet particles fall very quickly, and then unless person comes in contact, will not be falling on the other person. Or if a person maintains a 6 feet distance or 2 meter distance. However, if it's an aerosol, which means a smaller particle, and if one person is in the closed room for a longer period, more than 15 minutes, the pressure of the particles and the limited ventilation can result that even at the distance further than 6 feet, the person can get the infection because of those aerosolized particles.
Okay, so Dr. Vishal Rao, as a COVID task force doctor yourself, what do we now know about the 2 gaj ki duri? Is 6 feet not enough anymore? Do we need to revise our guidelines? What does this tell us?
Rishika, I think Dr. Chandrakant very nicely alluded to the entire point about the difference between aerosol and droplet. So when we cough, there are droplets, and aerosol is when it is dispersed in the air. Now I would like to add 2-3 points to it, and I think the Lancet paper that you are discussing about, or is a paper by Greenhoff, which actually spoke about 10 scientific reasons why they believe that airborne transmission is happening. And I think they have very reasonable reasons there that they have discussed. I think a few of the points which connect to the common man are related to, number one, that if a person is COVID positive and he's locked in a room, and if there are surrounding rooms wherein there are COVID negative people, they have found in instances, not always, but in instances, people have become COVID positive in the other rooms, clearly showing that this couldn't be because of droplet, nor could it be because of fomites. Fomites are objects wherein the potential infections and spread through these objects like clothes, furniture, etc. Even excluding those. Second, air ducts. Air ducts have found that had found viral particles of COVID, which again confirms that these couldn't have been droplets, but these air ducts were because of the aerosol particles alone. And similar such reasons that they have quoted.
So, Dr. Rao, my question therefore was that do we need to revise our guidelines, because we are still saying 6 feet distancing? Clearly, it's not enough.
I think the government of India has clearly been saying from the beginning about mask. Every government has been talking about mask. More than revision of the guideline, we need to have stronger enforcement of these guidelines. I think this responsibility lies with the people.
Okay. So, you know, we sort of put this issue out and we got a lot of questions on social media. But before I go and address all of those questions one by one, Dr. Amrish Mittal, you know, a lot has been said about 6 feet distance not being enough in an indoor space. But given the fact that the droplets, you know, they fall relatively quickly, but it is the dry aerosol particles that can remain suspended in the air, and studies say even for hours, how safe are we outdoors?
So I'll first reiterate what my predecessor said, and that is all guidelines emphasize masking. And I think it's important that we don't forget this, whether it's 6 feet or 8 feet, that's not going to change in a hurry. But the main thing is that if you're wearing a mask, or as they say, double mask now, or an N95, you're fairly well protected. Not 100%, but fairly well protected, even in an indoor environment. That's very, very important. Now, obviously, outdoors, there is no such, I mean, there shouldn't be any paranoia about going outdoors. It's not that the virus is floating around everywhere and you're just going to catch it every time you go out. I think it's important to go out. If you have to go out, you wear your mask properly, the way it's supposed to be worn. If you want to go for a walk, you do that. Don't treat it like a social activity. Walk with somebody. If you're crossing somebody, just say hello, hi, and cross over. Don't have conversations standing close to each other. Then outdoor, the particles dissipate very quickly. There is very little evidence that in the same way as fomite transmission can happen through touch, same way outdoor transmission can happen, but it's much, much less important than indoor transmission.
Okay. So we've gone into the nitty-gritties of what aerosol transmission means, what is the 6 feet rule, but now let's come down to the brass tacks. What does it really mean for our daily lives? And on FYI, that's what we focus on. What do these developments mean for you? The first question, therefore, that a viewer sent us is, can a double mask save you from aerosol transmission? Dr. Laharia, would you like to take that on?
The answer is yes. So we know one thing. If we are using N95 mask, you don't have to wear a double mask. N95 is more than enough to protect from aerosol transmission. The only point is that no matter which mask you are wearing, you have to wear mask correctly, tightly fitted, covering your nose and mouth. So that's one. Then it comes to double mask. Double mask is usually means a surgical mask worn first, followed by a cloth mask. And again, it should be worn in the same way, then it will protect you from the aerosol transmission, all modes of transmission. Here is one of the important things, and this is related to previous discussion, is that we need to wear masks as soon as we are out of our door or house. Even if you are living in a multi-story building, often people use the stairs or elevator. You have to wear masks every place outside your own home, every single time.
Okay. Very important, and a lot of those questions, I'm going to come to a lot of those, you know, technical nitty-gritty questions, daily doubts that we all have. How long do the particles remain in the air? Dr. Mittal, you know, I know the guideline says 15 minutes up to a couple of hours, but how do we know if an indoor space has actually truly been disinfected?
No, actually you cannot. The studies that have been done have not been able to pinpoint exactly in a clinical situation how long a particle remains, but experiments have shown that they can remain up to 3 hours. There are studies showing that, but that does not mean that they will remain infective for 3 hours, or the whole thing is not absolutely clear. But yes, if you want to be on the outer side, you can say 3 hours, but typically it's a few minutes, maybe to an hour or so, but no one has a final answer on that. The important point again would be that if you're entering a space where someone has actually released a lot of particles, you are exposed. And it's not that if the person has gone out of that room and because he's, if it was only a droplet, it would just be okay if the person is out.
Right.
The fact is there could be particles floating for some time and you could catch, but a lot of this depends on the viral load, on the ventilation. Very, very important to have proper ventilation indoors as far as possible in public indoor spaces. You need to keep doors and windows open. That itself will save you a lot from infection.
Okay, I think that's something that's been highlighted time and time again. Is exercising outdoors safe without a mask? Dr. Vishal Rao, this is a very commonly asked question given the fact that gyms are shut in most parts of the country right now. People are trying to go outdoors to exercise. Can they exercise outdoors without a mask?
I think to sum this up between what Dr. Mittal said and what I was emphasizing earlier, most important what people need to understand is good nutrition, good air and good health with exercise should not be neglected. Simple.
Right.
But in addition to that, I think it's extremely important that you continue to wear a mask, and addition to that, keep your area ventilated. It's very, very important. Remember, stagnation of air is the core problem there. And that's why it will remain from 3 hours to whatever number of hours that we are talking about. It's the air ventilation that is going to be the denominator. The mask is one aspect of it, but the denominator is going to be the air ventilation.
Yes.
So the better you ventilate, the more safer you are. That's when you allow air to channelize there.
Okay, but can you exercise outdoors without a mask?
Masks in the current aerosol transmission has to be worn at any cost.
Okay. I think that answers the question. So even if you're exercising outdoors in a park, you must absolutely wear a mask.
At the moment, Rishika, because of the situation, we're really in the middle of this.
Of course.
Maybe sometime later we can say if you're exercising alone in a park, it doesn't matter. But at the moment, I think one should be overcautious, not complicate things. Wear a mask all the time you're outside your door.
Okay, I think that's the simple, straight answer to everything. Wear your mask. When in doubt, just wear your mask. Okay. What is the protocol for going out for a walk in the park? Dr. Aparish Patel, I know you've been asked this question before.
Yes, the same thing. I've more or less answered it. You can go for a walk in the park provided you wear your mask. It's important. If you can avoid going in a crowded, don't go when the park is crowded. Park should not be crowded. Go at a time when you don't have to meet people. Just go with your whatever music in your ears or something. Just go and take your walk, wear your mask properly. It's rejuvenating. It's important for your health, for your mental health also.
Yes.
So I am not one who says that you should keep yourself locked indoors all the time. You'll go nuts anyway.
Dr. Chandrakant Daira, if I can bring you in here, because speaking of mental health, I mean, that's a whole different conversation that we need to have. But, people who say choose to meet each other outdoors, whether it's in a park, wearing masks, how far should they be sitting from each other if people are meeting outdoors?
So as the previous speaker are saying that currently we are in the lockdown and meeting outdoors is not allowed. So we have to follow the current timeline and the guidelines. However, in other circumstances, in office space and other places, if people are going to workplace, we have to follow the similar guidelines we were following earlier. But we need to wear the mask or double mask. We need to keep the room or space ventilated. And outside, in the parks, etc., it's not currently allowed to go and meet publicly.
Right. No, but if you are, say, going down for a stroll in your own building and you do meet somebody, how far should you sit from them?
If you are going down and with your family members, of course, you have to wear mask, but you need not to maintain the distance. However, if you are meeting the neighbors and other places, wear double mask, maintain 6 feet distance, and ensure that you are meeting with those people in a space which is really well ventilated. Don't stay in a closed space for longer than short period.
So even if you
more than 15 minutes.
Okay, so you're saying that even if you bump into somebody in an outdoor space, it is safer to wear a double mask and interact with somebody even if you are meeting in a park or outdoors. What is the protocol that needs to be followed in stairways, in lifts, and in toilets? This has been a very commonly asked question. Dr. Rao?
So I think, Rishika, the emphasis again remains that in most of these areas, one needs to understand that it's not about whether you know the person, you don't know the person, it's family or friends. It's more important whether they are positive or negative. Now we don't know because it's a dynamic process. And it's very important to better assume during a pandemic that the person whom you are interacting with is most likely positive. That's the best way you keep yourself safe at the maximum. And that's what we've been talking about, that wherever you are, in your socio-economic zone, whether it's your apartment, your house or your work zone, run it like how the doctors were running a clinic, like a hospital. That's the safest way to be. Your gloves, your mask, your face shield is the safest way to be to protect. And most lifts today outside have a hand sanitizer. Yes. Double mask yourself and protect yourself and avoid overcrowding. That's the most important lesson. And if possible, take a walk across the stairs if it's not too long, because that will keep you further healthier.
Right. Dr. Mittal, anything you'd like to add about stairways, lifts, even toilets? This has emerged as a very big cause of concern now that we're talking about aerosol transmission.
So lifts, yes, you always must wear a mask. There's no question. Lifts could be because they're closed environments, and especially if it takes a little longer, that's one. Stairways, again, you should wear a mask, but if you have to choose between lift and stairs, stairs is better than lift. Because stairs are still open, lift is all closed, right? Okay. So you have an option and you can do those 3 or 4 floors, do it, right? Toilets is a new thing that has just come up in a big way. It's still not proven. I know there is some data from Hong Kong showing transmission, suggesting transmission, but it's not, I mean, I think people are getting paranoid about it. If you want to be very careful, the only thing you have to do is you keep the lid on when you flush.
Right.
When you flush the toilet, keep the lid on. If everyone does that, I don't think it's going to really reach through the toilets easily to each other or, from the upper floor down or down floor up.
All right. Dr. Chandrakant Lairia, can air purifiers or humidifiers in a room reduce the risk of aerosol transmission?
See, it depends upon which type of air purifiers are being used. The HEPA filters definitely helps in purification of the air. However, in most such circumstances, it is preferable that the room or the air, the doors or windows are open and the room is well ventilated. That is the best way to reduce the transmission, because we know the higher the quantity of air in the room, it will dilute down the quantity of aerosol and it will reduce the risk of transmission.
Right.
And of course, after that, the air purifier other functions well, depending upon how frequently, which type of air purifier it is, how frequently the filters are changed, but we need to be careful. The best way is keeping the room well ventilated and following all the behaviors which we are talking about.
Okay. The other question now that has come up, since one is talking about aerosol transmission and since, research is now showing that COVID is predominantly transferred, through the air, how does one purify the air? So if you enter into a closed space like a lift, what should you do? Dr. Mittal, should you spray it with a sanitizer?
I don't think there's any such thing. The only thing in the lift which is different from others is that, yes, you should sanitize your hands for sure.
Okay.
Because it's often a public space, people may have touched. So I use my elbow to run the lift always. I have not used my fingers for more than a year now. And if by chance you do touch something, make sure you sanitize your hands. You can't clean the air like that.
Okay. Dr. Rao, anything you'd like to add about, people have asked this question, should they be spraying sanitizer in the air? Like they spray air purifiers?
Rishika, there was an old discussion sometime back that in COVID, one of the symptoms is loss of sense of smell, but also loss of common sense. So we need to apply common sense here. And I think, the CDC or any FDA cannot give guidelines to this, but I would like to add just a simple point here that caution is very, very important at any of these junctures for an individual to protect himself. It boils down to well ventilation and mask. And I wouldn't prescribe to air purifiers because air purifiers purify air, not COVID.
Very important.
Air purifiers were able to solve COVID, it would have been a different game altogether.
I think net, what all of you are saying is that the only way to actually purify the air around you is to ventilate it. So open your doors and windows and let fresh air come in. But another question that's come in from a viewer is standing in your balcony safe without a mask? Dr. Rao, you did cite some anecdotal evidence of the fact that COVID can spread through air ducts, etc. if you are living in an enclosed space and if you have COVID positive cases around you, is standing in your balcony without a mask safe?
Again, balcony is a very ill-defined term, because if you are in a crowded area wherein there are two apartments sticking next to each other, the virtual distance sometimes may be less than 6 feet in certain areas. So what's very important to understand is your personal safety. If you are in an area, even if it's a balcony which is very well ventilated, it's your own caution not to wear a mask. But at this juncture, if you have a neighborhood person who's COVID positive or somewhere in the surrounding, absolutely not safe in this juncture. Avoid every instance to try and say that this will not come to me. And that is what has happened to many families today who said that why should I get it? I'm not going out, or I'm just standing there. And these are the people who have got positive today.
Yes. And I think it's important to understand some of these very basic fundamentals, because we are seeing in the second wave that people are testing positive and testing positive in clusters. Entire families are testing positive together. So hope that some of this has been useful to understanding what's really happening with COVID-19. Thank you all very much for joining us. We're going to slip into a very short break, but coming up on the other side, we have Dr. Aisha Dwivedi joining us from the US. She's going to talk about what the US CDC guidelines are, how they are being implemented in the US, and the lessons that India can learn. All right, you're watching FYI. To talk more about the CDC guidelines, what they say, what's really happening in the US in terms of this whole 6 feet distancing rule. We have Dr. Aisha Dwivedi, Assistant Professor of Medicine, Lenox Hill Hospital, Northwell, joining us from New York. Thanks so much for being with us. I want to ask you one of the most commonly asked questions on social media. How can you clean your air better? Do spray sanitizers work? Is that going to be the new normal, given the fact that the CDC has said that now COVID is in the air and even 6 feet distance is sometimes not enough?
I think the research still needs to be done on that. We do not have conclusive data. But what is known is that when you are indoors in office spaces, that the building maintains a good amount of ventilation, and you limit the number of people in the office space and also the time that they spend in the office space. That is really the data that we have to go by so far. The air sanitizers, I think the jury's still out, and we're not 100% sure about how much they contribute. So I think we just have to wait for more research to come out before we can really answer that question.
Important, because what the CDC guidelines now say about COVID being airborne, how is that, changed the way guidelines are being implemented in the US? What can India learn at a time like this when we are seeing, the worst phase of the pandemic?
Yes, definitely. I think my heart goes out to all my, colleagues, family, and friends in India right now. And I think that in the U.S. especially, first the focus was on sort of sanitizing surfaces, not touching surfaces. I think the focus has shifted away from surface or fomite transmission, as we call it, to more of an airborne transmission. And I know that in the hospital, especially here, there's a lot of emphasis on maintaining a good air circulation. There's also HEPA filters, which filter the air to minimize the circulation of virus in the air, because obviously hospitals are, and people who work at the hospitals that are at highest risk for, contamination. Additionally, double masking has been recommended. So it's usually recommended that you wear a surgical mask with a tighter fitting cloth mask on top of that, which can also be helpful. And obviously N95 masks are definitely helpful. And I think that also now that the weather is getting better, just encouraging sort of the population to host gatherings outside and to limit the number of indoor gatherings and socializing as well.
All right. It's been extremely useful to understand that. The new CDC guidelines, they're issuing a number of clarifications and new revelations really on how COVID can spread through the air and what you need to do to stay protected. That's all we have time for in this edition of FYI. Thanks for watching.